Doctor, you suffered from mercury poisoning. Can you talk about how you found that out?
Well, I was tired of being crazy and being told I was crazy. I knew I was. But I just had to find out why. And crazy, by crazy, I mean I had episodes of, manic depression. I had uncontrollable bursts of anger with immediate remorse afterwards. I couldn't think straight. It's amazing to me that I actually made it through college and dental school the way that I did. Because I must have had a really miraculous brain before I was mercury poisoned, because it was still functioning pretty good. But I knew that I was out of control, but I didn't know how to get back in control. It was almost like, for lack of a better analogy, like a possession of sorts. Like I was not me. It would would take over me, and I wouldn't be myself. But then I would come back around and look back at the damage, and it was just like, no, wait a minute, So I knew that there was something wrong, and I went from doctor to doctor to try to find out. That was just my mental state. My physical state, I was ailing. I couldn't walk up a flight of stairs. I had just chronic fatigue, chronic headaches, chronic sinusitis, chronic ears plugged, tunnel vision. The list is pretty lengthy. It's a couple pages long. The kids couldn't sit on my lap. It hurt to touch me. Yeah, it's very bizarre, the way that mercury poisoning manifested in me. And once again, that was me. That's not everybody,
Sure.
So how I actually found out about that it was potentially the poisons in my mouth was my brother sent me to a holistic dental seminar. And it was Dr. Doug Cook and Dr. Tom Stone, MD. And they said, oh, well, root canals are bad and mercury's bad and blah, 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 blah. And I called my brother up, and he says, well, now how are you going to practice dentistry? And I said, I hate you. He rocked my world, because everything that my mom and dad, the ADA, told me I had just learned was incorrect information, and that I came into this to heal and help heal people. And in fact, I was doing quite the opposite. So being the kind of person that I am, and the disbelief that I held, I wasn't going to, I have to do research. I'm a researcher, so I wanted to look into this. So I'm using myself as a guinea pig. So I went in and I had my amalgams removed at a dentist trained to remove it properly.
How many did you have about?
I had 4, 8, 12, at least 16.
So a good amount, okay.
Yeah. And I have to say, my uncle was my dentist. And so it hurt me to learn that he too, took those words, and we were all taught that the mercury was locked in, it doesn't come out, and it's not going to hurt you. And maybe at that time they didn't have the research to show that, and now we do have that research, so we can put that myth to side. So I started researching. I used myself. I went, I had my amalgams removed, and boy, did I feel great. I felt like I could climb a mountain. I mean, literally, I stopped wearing glasses overnight. My ears unplugged. I was going for MRIs in my throat because it felt like something was choking me. And they kept telling me nothing was wrong. That cleared up. I would take Tylenol sinus every night to sleep. I didn't need to do that. I mean, all my energy started to come back. The psychological things took a little bit longer. That's when I started learning about the nutritional component to all of this, and how perhaps I probably shouldn't have gotten my amalgams out until I addressed my nutritional deficiencies first. So I am at work, and I was using myself, and so the protocol that I have, which is what I call the Meyer protocol, because it far surpasses anything else that's out there, treating each individual, not like a cookbook type, was based on my own experience, and then the experience with the patients that I have. So it took about 5 years for me to get better. The psychological things took a little bit longer, because indecisiveness was one of my hallmark. Trying to decide what to wear, let alone what's for dinner. and trying to stay married or get divorced. I mean, all these things. So it took me a little bit longer to go through the emotional stuff because things had been built up in my life that then needed to be cleared away as well. So I tried to address all of those issues. I'm a psychologist first. So I try to look at all of the behavior, the lifestyles of the patients. You know, if they want that. I mean, if they already know they want their amalgams out, I just have to make sure they're okay. They're going to be able to, handle it, an otherwise healthy individual. So we try to. So after that, I got a handle on my nutrition, and after that, then I was fine. And then I started my kids on it, and I started doing research on my kids, and because I was like, oh my gosh, if this is affecting me, what about my children? I was pregnant with one in dental school, had lost one freshman year in dental, or whatever year it was. I had lost one prior to that one, and so I started. I took my children to the Pfeiffer Institute, the Carl Pfeiffer Institute, where they actually treat. They're known for treating psychological illnesses like manic depression and schizophrenia and such. But I liked the way they did their testing. They tested hair, blood, urine, stool. They looked at like every body part. And so I started them on the program. I was the first one ever to present there for wellness, because they were treating sick people mostly. And so I brought my whole family in. And so we started on a fresh diet, new supplements, and at that time my children were taking asthma medications, allergy medications. My one boy was on prophylactic antibiotics for ear infections, chronic sinusitis, chronic candida. I mean, it was unbelievable what these I had little note cards with meds to give them, and I thought, this is wrong. So as I'm learning to heal myself, I then was clear enough, conscious enough, and had the energy enough to then work on my children. And so I was like, wow, only 2 of my children are showing excretion of mercury in any body fluid. And I thought, that's unusual. The one I was pregnant with in dental school is showing no mercury excretion. And then the one, my last child I was pregnant with in an office that was hugely mercury toxic. He actually ended up with the Mad Hatters. That gentleman, unfortunately, he's okay now, but he ended up having to quit working. But I worked there when I was pregnant with her, delivered her and nursed her, all with that mercury-laden milk and my body. So she, so I started, so she and he showed no mercury. And then my other 2, just a little bit. And I was like, oh my God, this is crazy. So I said, they should have it. They should all have it. It should be showing up everywhere. So after about 4 months on just supplementation, changing up the diet, I retested them again, and it was showing up now. It was showing up more in the 2 that were already excreting, but it was showing up just a little bit in the 2 that weren't. And I was like, praise God. I'm like, they're excreting it. I knew they had it, but they weren't getting rid of it.
Right.
So then another 4 months passed, and I tested them again, and now it was coming out. So I actually gave a speech at the Pfeiffer Institute to the nurses, the doctors, and Dr. Walsh. Didn't partake in that, but I believe he got the gist of what I was saying. So I was saying, you know what, you guys, just because it's not there doesn't mean it's not there. I'm like, these kids are just too sick. Their little systems are broken. They're not excreting it. So just like the fish, the bigger fish, they tell you don't eat the big fish. So we're bioaccumulating. So I think my children were fortunate to have me as their mom. So then I started detoxing. And detoxing, by that I just mean supplementing. The proper supplementation for them, the proper food. Because if you supply the body with what it wants, it's going to just fix itself,
Sure.
And that's what I realized with my kids. So it's been a lifelong journey. I mean, they're young adults now.